Hello, I'm Stephane Bilodeau, part of the Endcoronavirus team on high-risk institutions, and I want to give you a short update related to the ECV Nursing Homes project. So a new study that was published by the Journal of American Geriatrics Society could inform the ongoing effort to protect nursing homes residents. So this study was made possible in part by their formal connection pre-COVID with the Academic Medical Center of the University of Michigan. And many items that are underlined in the study were covered in our ECV guidelines released in July. So, sorry, these guidelines. I just want to highlight some of the things that were integrated in some ways to the ECV guidelines at the time, and that were identified in the study by the University of Michigan as successful measures that played a crucial role in containing the outbreaks of COVID-19 in the study facilities. So first, outbreaks identification, data collection, and survey were crucial, absolutely important, and they were using proactive testing of both symptomatic and asymptomatic residents. That's important. That was mentioned in our guidelines. And not only that, but also timely test results, so really rapid results. Second, they were talking about cohorting. So upon identification, COVID-19 residents were moved to a dedicated COVID unit, another important thing. So rapid action in general, but also implementing existing plans. So they have defined their plans before. Another important item. Personal protection equipment assessment and use extensively in these facilities, important thing. Concerning the staff and organizational considerations, a couple of notable items. Staff who worked at more than one nursing homes before were asked to pick one and work there exclusively to avoid carrying the virus between facilities. Also, staff received hazard pay, so meals, and in one nursing home even, a dedicated space to stay overnight to avoid taking the virus home to their families. Special break areas were created and formally used for communal resident activities, for example, but to allow staff during the COVID time, to allow staff for space to decompress and eat during a stressful time, important thing. And also the facilities leadership regularly communicated about testing and results with residents, but also with healthcare professionals and families, and embark in intensive cleaning as well as training or re-education efforts for the staff about to be better equipped about personal protective equipment use as well. For info, on top of all these considerations, we would only add a couple of items which were also in the guidelines and not mentioned in the study, but for example, proper ventilation and air quality, screening questions to quickly identify the risks, and also encouraging employees to implement safe space practices. But this study confirms in general or say, since all successful nursing homes in the study went into the pandemic with a proactive partnership-based approach to general infection prevention, and their response plan were already in place that paved the way for effective COVID-19 containment. So this is all music to our ears and definitely a confirmation of our main guideline message. Thank you all.